Good morning, everyone. Thank you so much for joining us. We're glad you could be here. And we'll get started in about 3 minutes. Please feel free to enter any thoughts or questions you have in the chat, and we'll do our best to answer. And if I don't have the answer on the spot, I will find it and send it to you. All righty. 12 o'clock on the dot. Welcome again. So we're all excited to see what you have planned for your submissions. And if you have any questions, please put them in the chat. We'd love to hear your thoughts and comments and observations as well. Anything you'd like to share, and each one teach one. Alrighty. So today we will review our submission reminders. I'm Phoebe Nelms. I'm with Hybrid Solutions here at Morehouse School of Medicine. And as you know, we provided QPP support with CMS funding for 5 years, and we continue to do so on a subscription basis for anyone who is interested in having assistance with that. So we'll talk about just some high-level things about the QPP MIPS. Many of you are pros. You've been doing this for a while, but some are brand new to the entire QPP program due to their taking on a new role in their organization. So we'll review the submission process, a MIPS submission checklist, things that we really want to pay attention to avoid jeopardizing our submission, and then we'll have the opportunity to field questions, and hopefully I will have the answers. I thought this cartoon really captured some of the thoughts and feelings of providers as they participate in various programs. I'll give you just a minute to read it. I thought it was quite truthful. If only the electronic health record systems that we each individually use made it easy to capture all the information that supports our reporting. That would be awesome. We're getting there. So why should we report to the quality payment program avoiding the penalties that reduce your Medicare reimbursements at potentially a reduction of 9% if you're an eligible provider is a very good motivation and incentive to report. You can also earn bonuses for high performance and enhance your practice's reputation through public reporting to the Medicare Physician Compare website. If you have not visited this website, it is definitely worth you're looking at. And this is not a live link, but it'll give you an idea of what to search for. Medicare.gov Care Compare, where each clinician scores and performance is available for public review. So CMS also hopes that by participating and reporting in the quality payment program, it'll also contribute to better patient outcomes and the transition of our healthcare system to value-based care. So you can now submit your data. The portal opened on January 2nd, and the deadline, the last opportunity to submit is March 31st, 2025 at 8 p.m. And your submissions won't be final until that time. You can change anything you have uploaded or attested to up until this time, but after this, no more changing. So just a very, very high level overview of the total score that you will achieve and the weights for each category of the MIPS performance, quality, cost improvement activities, and promoting interoperability. And so we have a more detailed slide to follow. The threshold is 75 points. That is the absolute lowest number of points you can get to have a neutral payment adjustment. Anything other than that, you can, if it's above, you potentially get a positive uptick in your payments. But if not, then we go into the possibly negative territory. And this is more detailed. The weights for each category, and then each total number of points that is achieved for that category is added together based on its weight. Also, you have the potential to get a complex patient bonus and also small practice bonus. So you can see the breakdown here of the ranges, 75.01 to 100 points, based on the scaling factor that CMS applies, that determines the percentage of the positive uptick in your reimbursement that will be achieved. 75 points for neutral, and anything below 74.9 to 18.76, then the negative payment adjustment can be between 0 and -9, and anything below 18.75 receives a negative payment adjustment of 9%. So we now dive into our submission checklist. By now, you've all reviewed the eligibility status of your clinicians by looking at the CMS participation lookup and entering the clinician's NPI number that's associated with your particular organization to see their eligibility for your practice. And then you want to decide if you're going to do an individual or if you will do group reporting. And how will you submit your data? Will you attest directly into the QPP portal by putting in the numerators and denominators and the improvement activity numbers? Or will you upload a report from your EHR directly? In order to be able to access the portal, you have to make sure that your credentials are up to date. And if you need to reset your password, please use the information, the link here. I will follow up with an email with all these links after our presentation today, just in case you need it. For those who may need to create an account, There's also information available. And once you log in, then you can access your organization and see which eligible clinicians are listed under your organization. Sometimes this may not be up to date if you have not updated the links to your clinician in PTAN. So if you are going to submit a report generated by your EHR, then please, if you need assistance from your vendor, request that assistance as soon as possible so that you can have the correct file format to upload into the QPP portal. And then you'll select the category you're deciding to report for and enter the data for that category. So here's just a visual logging in, using your up-to-date credentials, access the organization that you're going to report for, have your report in hand so that you can follow along and be as accurate as possible in what you enter into the portal. Didn't mean to skip that. One of the things that we really, really want to emphasize is that everything that you report and submit to the QPP portal, to QPP, make sure that you review the validation documentation that supports what you've submitted and save a copy of that evidence in your audit folder so that if you are ever randomly selected for an audit, which can happen anytime between the submission period and 6 years out, you will be prepared and you won't be scrambling to try to find the documentation that's necessary. So that's very, very important. We'll repeat that a couple times throughout our presentation today. So yes, so depending on how you decide to report, whether group or individual provider, upload the QRDA3 file and save that copy of that, the one that you uploaded, to your audit folder. Make sure that the report has the very best quality measures that you achieved reported. And remember that some measures are inverse measures, so they may not look like good measures, but be sure to identify those inverse measures and select ones that you do well on. And if you need assistance, please, please, please reach out to your vendor. Don't wait to the last minute so that they can help you to get the report that you need for the time period that you are looking for. And the portal has made it so much more user-friendly to upload your files. When we first started out, it was not quite that easy, but now it is. So we're moving on from quality to improvement activities. No doubt you've selected your improvement activities earlier in the year, and you have saved the validation materials that you need to support attesting to doing these activities. You want to understand the weight of each of the improvement activities that you've selected. For small practices with 15 or fewer clinicians, they are required to just do 1 high-weighted activity or 2 medium-weighted activities. Select the date range of the activity, any consecutive 90 days. Do not report more than you need to. I used to think that, oh, more is better, but no, not so, because if you are selected for an audit, you're responsible to prove that you've done everything that you attested to, and you don't get any extra credit for doing more. So make sure that you have reported enough to receive full credit. So not just 1 medium if you're a small practice, but 2 medium and at least 1 high. And again, save copies of your proof, your evidence that you've met the validation criteria that QPP provides in the resource library, and save that for at least 6 to 7 years. Okay, so improvement activities, that's maybe not the easiest to do, but definitely the easiest to report. And we're going to move on now to promoting interoperability. Of course, you have to use a certified health record. And sometimes it's easier to get this identification number from your vendor, and if not, request it. But you can also look up your vendor's CHPL number on this website. And again, I'll send these resources in a follow-up email after the webinar. So submit your performance data for the required measures in each objective, unless, of course, you qualify and claim an exclusion. And this year, we want to be sure that we are keeping up to date in the fact that it's 180 consecutive days. It was 90 for so long, but now it's 180 consecutive days that you should report on the selected measures. And there are also these attestation statements that you have to respond to in the affirmative. So here they are listed. And so we want to attest to these. Otherwise, we'll miss out on the entire category, and I would hate for that to happen to anybody. So attest yes to these questions that come up in the promoting interoperability category. And of course, for the security risk analysis, you want to make sure that you have a documented mitigation plan for any items that are revealed in your analysis that might need to be addressed. It's great to say yes, and you have to have a saved copy of it, just again, in case you're selected for an audit that proves that you did it for the time period that's required during 2024, and that any items that were identified as risks, that you have a plan in place and a deadline to mitigate those risks. And the safer practice guide, just the high priority section of those guides, because there's a ton of them. We have to say yes to having reviewed that. Okay, so some of the measures that are available to report on are e-prescribing and querying of the PDMP. Note that if you claim an exclusion for the e-prescribing measure, you can't report the query PDMP measure. And so an exclusion will automatically show up for that one. For health information exchange, there are 3 options. So option 1 is you support electronic referral loops by sending health information. And as a part of option 1 also is that you support electronic referral loops by receiving and reconciling health information. So all referrals, you have to have that documentation that you either sent or received it and reconciled it electronically. Or option 2, you can utilize a health information exchange, bidirectional exchange. Some EHR companies have this built in as one of their services, or here at Hybrid Solutions, we have a health information exchange that you can join. And that connects to Georgia Health Information Network. Option 3 is enabling exchange under TEFCA. So many of these are vendor driven, and you should ask your vendor for future years what their functionality is to support you in using all of these options. Promoting interoperability, provider to patient exchange. So that would be providing patients access to their health information through a patient portal and documenting your processes as to how you do this and how you provide access, just in case you're selected for an audit, and some evidence of the exchange between clinicians and patients for audit preparedness. For the reporting, you just have to enter the numerator and denominator for the patients that access the portal or receive information from their clinician through the portal. Public health and clinical data exchange. Report to the following public health or clinical data registries. Reporting to the immunization registry, or using the functionality of your electronic health record to do electronic case reporting. And many are actively able to support this activity. The other options are to report to a public health registry or a clinical data registry, or to the syndromic surveillance reporting, which you can go to the Department of Public Health website. If you have not yet, you can fill out that document that they provide, which basically lets us know that it's not available to small practices in Georgia. So these are more of the details around the promoting interoperability to registries or public health organizations. You can attest to being in active engagement with a public health agency to submit immunization data. Of course, that's GRITS here in Georgia. And if you do not administer immunizations, of course, you can meet the exclusion criteria and select that exclusion. And all the details for these are contained, of course, in the measure specification sheets for each and every one of the measures that are part of the promoting interoperability category. You can also attest to being in active engagement with the public health agencies, as we mentioned earlier, to submit electronic case reporting of reportable conditions. To the, I think that's the Department of Public Health sends. But if you meet the exclusion criteria, then of course you can select that exclusion. And also, if there are additional registries that you report to, then of course you can select that option and get extra credit for participating in other registries. Some specialties have their own registry organizations that they report to, and you can use those as extra credit. So we want to go over these reminders, just things that make it a little easier when you're actually sitting down to do your reporting on the QPP portal. If another organization is not doing it for you, we'll get into that later. Well, you'll want to have your report maybe on another screen or print it out so that you can see all the data that you will need to enter in manually, your numerators, your denominators, your improvement activity identification numbers, and so on. And if it's just a yes or no measure, of course, you're fine. But then if not, you have to enter in your numerator and denominator. Check your entries, double check, maybe have somebody sitting beside you with another pair of eyes to make sure that you enter actually what is on your report, and that will be in your audit folder. And so again, to support your audit folder, make sure that you save copies of all the documents that support the responses that you've submitted into the portal. And make sure that you also, if you qualify for the exclusions, please select those. And don't leave anything blank or with a 0 if you don't have an exception or if you don't take the exclusion for it, because that will cause you to fail the entire promoting interoperability category, and we don't want that to happen to anyone. So double check, triple check. And I know we've kind of beat this to death, but prepare your audit folder. Save a copy of the reports that is generated by your electronic health record system for the quality category especially. Because as you know, a report you run today may not come out the same when you run it 3-6 months from now. So please generate that copy that you're going to upload and save it somewhere for your audit records. And save the promoting interoperability reports too for the period you've selected. And remember, this year is 180 consecutive days. Also, if you look at in the resource library, the QPP resource library, if you put in the word validation, all the proofs, all the things that meet their requirements will come up as a resource for you in the documents for each category. So you want to review those and make sure that you save what counts as proof in your audit folder. And once you actually do submit your data on the QPP portal, it's a good idea to save a screenshot of your submissions to PDF and put that in your audit folder as well. I've been talking and I want to know if anybody has any questions that they'd like to put in the chat or any observations about how it's been for you with QPP this year. Okay, so when you do enter your scores into the portal, they're not final. So that's why we go back and we check up until the March 31st deadline. Make sure everything that's in there is what we actually want in there. But you can make adjustments if need be. Also, some healthcare providers have third parties reporting for them. So of course you want to check what they have put in there for you. Okay, I will check on that. A question is, can we use fall risk as a quality measure for 2024, 2025? And are we able to report fall risk assessment as a CQN this year? Okay, I'm going to capture those questions and I'll follow up with our post-webinar email to make sure that I provide the right resources and answers for those questions. And I'll share them with everyone. Ashley, if you could be so kind as to just capture those questions for me, I'd really appreciate it. Okay, so if someone else reports for you, another organization, a registry, your APM, be sure to check what's in the portal for your organization, for your practice. Even if your EHR vendor submitted for you, especially the improvement activity category, not only do you want to know what they have submitted for you, also want to make sure that you have saved, if applicable, the audit folder information to support that. So this one is very, very important. You can use a combination of reporting methods, especially with the category, the quality category, and CMS will give you the best score out of all the reporting methods that you use. That is not the case for the promoting interoperability category. If, let's say, an organization reported PI for you, and then you also report PI, they cancel each other out and you get loose eggs. So make sure that only one submission for the PI category goes in for your organization. Again, the deadline is March 31st. I can't believe we're like almost to the end of January already. 2025 is flying by. So we're available to assist, and please reach out if you have questions that we can assist with. And of course, the QPP help desk is great, and you can escalate questions if there's some sticky things. And don't forget to, when the time is right, to check your final scores, and also that period where you can, if things don't look the way you thought they would, ask for a targeted review. Remember that that's also an option. So we're glad that you could join us today, and we can go over the submission checklist, and I'm confident that you've got this. Okay, are there any other questions? Okay. We are really encouraging everyone in the healthcare space to take advantage of this training that is offered. It's free. It provides continuing education credits. And I think, Ashley, you were going to put the links for us. Awesome. Look at you. Yeah, so by either using the links in the chat or the QR code on the screen, you can take these courses, and please at least complete the very first question of the assessment, so that you'll get credit for completing this. So it's designed to support healthcare providers in communications with individuals, with patients who have disabilities. So it's an excellent training, and it's at no cost and provides continuing education credit. So if you'd like to, please take advantage of it and share it with staff. So we'll follow up our webinar with resources. Again, the links that we had in the presentation, and also I'll do some research on the questions that came in, so that we can provide everyone on the call that registered with the information. Of course, general information is provided at qppcms.gov. The resource library is dynamic. It's wonderful. They promised at the beginning of QPP MIPS that they would provide all the resources that we need, and they have done a really great job. There's a link to the safer guides, the health IT product list, and the phone number for help with HARP password reset. And we hope that you all get your submissions in and relieve the stress and have success in MIPS. So thank you all again for attending, and please reach out if we can be of support or assistance. And we hope you have a wonderful rest of the Tuesday.